Okay, I'm gonna start by checking the accuracy and the completeness of the MAR with my physician's orders. I have both of these up, I'm comparing them, they all look good. I'm gonna check my patient's chart for allergies. My patient is allergic to aspirin and triple antibiotic ointment. I'm gonna check for contradictions of the medications. So all of my patients' 9 o'clock medications include digoxin, glucophage, beta-optic ophthalmic solution, and Robitussin and triple antibiotic ointment. However, as I stated before, they are allergic to the triple antibiotic ointment, so I will not be giving that. I'm gonna review the assessment and lab values and obtain vital signs as needed. So I'm gonna go ahead and check my patient's apical pulse. So this is between the 4th and 5th intercostals. Okay, great. His pulse is 80, or her pulse is 80, because you're Reba Johnson. And I'm going to check for blood pressure. My patient's uncooperative. Okay. My patient's blood pressure is 120/70. It's very good. Okay, I'm gonna go ahead and wash my hands and I'm gonna gather my supplies. So I'm gonna put on my gloves. And I'm gonna unlock my medicine cart and I'm going to prepare my medications for the patient. So I'm gonna go ahead and compare each drug label to the MAR twice before going into the patient's room. So this is my Robitussin cough syrup, 50 milligrams or 5 milliliters right here. My digoxin 0.12 milligram tablet right here. My beta-optic ophthalmic solution right here. And my glucophage 500 milligram tablet right here. And I'm gonna go ahead and check all of these twice, compare them to the MAR. And I'm also gonna go ahead and check their expiration dates. So December 2020 for the glucophage, December 2020 for the Robitussin, December 2020 for the digoxin, and October 2022 for the ophthalmic solution. I'm gonna go ahead and calculate my dosage correctly. So first we're gonna go with the Robitussin. And I'm gonna give my patient 50 milligrams or 5 milliliters of this. I'm gonna pour it at eye level so I can see it perfectly flat. Okay. It's exactly 5 milliliters. I'm gonna give my patient their glucophage tablet. Oops. And there's digoxin. And I have my patient's eye drops. All right, I'm gonna go, I'm also gonna grab water for my patient's oral medications. Okay. I'm gonna go into my patient's room at bedside. I'm gonna check everything one more time and compare it with the MAR. Okay. Sir, or ma'am, can I see your wristband?
Of course you can.
Can you tell me your name and date of birth?
My name is Reba Johnson and my date of birth is the 31st of March, 1995.
Wonderful.
5:55.
And I'm checking my patient's number and their room number. And I'm going to go into their chart and check for their picture as well. Okay, I'm going to explain the purpose of all of these medications. So your Robitussin is going to be for your cough that you've complained of. Your glucophage is your anti-diabetic medication. And and your digoxin is your rhythmic medication. Okay. What do you know about these medications?
I know that one goes in my eye, and those two I have to swallow, and that one is I also have to swallow.
Great. And I would ask the patient if they have any questions and educate them as needed. I'm gonna put my patient in the appropriate position, which would be a high Fowler's position, so sitting position. It's already in this position.
I'm sitting.
And I'm gonna have fluids ready to take with my patient's oral medications. So we're gonna start off with your oral medications, so your glucophage. Perfect. And here is some water. Here's your digoxin. Lovely. Okay. Next, I'm gonna give my patient his Robitussin. Okay, and now I'm gonna give him his beta-optic solution. So I'm gonna put this into the lower lid pockets of my patient's eyes, and to prevent systemic effects, I'm gonna have him close his eyes for 2 to 3 minutes. So tilt your head back, and I'm gonna put this in the lower pocket. Close your eyes for 2 to 3 minutes. Okay. I am going to assist them back to a comfortable position. I'm gonna discard soil supplies, so I'm gonna take off my gloves properly without touching anything.
Yeah, I need to switch that. I don't know why that's still like that.
Okay, discard. I'm gonna wash my hands, and I'm going to document this in the MAR, and I'm going to check on my patient in 30 minutes.